Now it is my honor to introduce Mr. Jim Kaufman, the Executive Director of the West Virginia Hospital Association.
Good afternoon. Thank you for the opportunity to present. I just want to take an opportunity to thank Dr. Nimitz and Don for organizing this great event, really looking at the opportunities in bioscience, because we know that that research today will have a huge impact on healthcare delivery tomorrow. And I also want to stop and recognize Senator DeCubo and Delegate Chris. You two are phenomenal champions for healthcare in the state legislature. And I also want to say thank you for your service to the citizens of West Virginia, because we know it is a huge personal sacrifice because it takes you away from your families. So please know how much we do appreciate your service. With that, let me talk a little bit about the West Virginia Hospital Association. We have the privilege of representing all 72 hospitals in the state. We are one of the few state associations that have that privilege. And one of the things I really do appreciate, and it's a unique characteristic of West Virginians, all 72 hospitals, now I'm sure you've seen commercials and heard the rumor, hospitals compete with each other. I'm fortunate when they come into the association, they leave that competition outside. They share data, they share best practices, they share quality of care efforts, and the whole goal is, as an industry, how do we make access to care and quality of care better in West Virginia? And we do recognize all of those efforts because it is absolutely critically important. Now, when you look at the hospitals in West Virginia, I want to put our 72 hospitals, to keep it simple, into three big buckets. The first bucket is the general acute care hospitals, or the prospective payment system hospitals. Those hospitals, it's a federal designation at PPS. It's how they're paid. And it's really simple. They're paid on what they call a diagnostic-related grouping, which means they're going to get a payment based on that procedure or that care. Now, it's based on averages. So understand, if that procedure averages a 3-day length of stay, but the patient is there for 4, 5, or 6 days because of their complications, they don't have access to stable housing, or the insurance company's not approving their post-acute care discharge, that hospital is still only getting paid for 3 days, regardless of the amount of time that patient's in the hospital. The next big bucket is your critical access hospitals. Those are your smaller rural hospitals that have 25 beds or less, generally 35 miles from the next nearest facilities, unless they're in mountainous terrain, then it's 15 miles. That's a federal designation as well. Now, what's important to note, those hospitals are paid on allowable cost, not total cost. It's allowable cost by CMS minus 2%. I've actually had people say, oh, well, those hospitals are guaranteed a margin. Yes, think about it. They're guaranteed a margin of -2. That's a challenge. And then our third bucket of hospitals is what we refer to as our specialty hospitals. They're your children's hospitals, your post-acute care facilities, your long-term acute care, your rehab, your mental health facilities. All of them are paid very differently. And I lay this out because a lot of people like to think that all hospitals are the same. And I try to put these in these three buckets to explain how there's so much variation among hospitals just in West Virginia. Now, when we also talk about hospitals, people usually think about the emergency room, the inpatient beds. Hospitals are doing a lot more than just providing care. To give you an example, we invest more than $1 billion annually in community benefits. Within that $1 billion, roughly $100 million is for things like cooking with cancer, diabetes education, health and wellness programs. And I point all this out because it shows you how healthcare is radically different than any other sector of the economy. Tell me one other sector of the economy that takes a portion of their revenue, shares it with their customers to educate them so they don't need their services. Think about it. The whole goal of diabetes education is to help make that person healthier so they don't need healthcare services. That is a very unique factor in healthcare. Now, the other thing is healthcare hospitals, we're economic engines. We're generating almost $17 billion in the West Virginia economy every single year. Often they're the single largest private employer in any community. In aggregate, we're directly employing 54,000 West Virginians. That's critically important because this is a growing sector of the economy. Now, let's go behind the curtain and look at some of the challenges and opportunities within the healthcare space. Now, like every single person in this room, hospitals are dealing with inflationary pressures. To give you an example, that bar chart on the right shows that between 2019 to 2022, the most recent data available, healthcare costs for hospitals went up by 18%. However, reimbursements by Medicare, which already pays below the cost, only went up 8%. It shows you that gap between payment and cost is getting bigger for governmental payers. Now, when you specifically look at some of those cost drivers, we'll look at the average cost of 2,000 drugs that are used in hospitals. In 1 year, those prices went up by 15%. Wages went up 10%. Now, these are national numbers, but it really starts to show you some of those problems that we're seeing as healthcare costs are going up. Reimbursements are not keeping pace. Now, when you talk about the workforce issues, that 10% labor increase, it's not going to get any better. According to the U.S. Bureau of Labor Statistics, annually, up to 2030, we're going to be looking at more than 200,000 vacant nurses positions every single year. According to the Association of American Medical Colleges, by the end of this decade, we're going to be looking at a shortage of more than 100,000 physicians, both primary care and specialty care. That makes it a major challenge to recruit and retain healthcare providers because as we're producing them in West Virginia, they can go anywhere they want in the country. Now, the association, we started looking specifically at opportunities and jobs within West Virginia hospitals. And what we hear over and over again is there is a huge shortage in nearly every single clinical and non-clinical position in West Virginia hospitals. Now, we started collecting data specifically on 4 major categories of job classes in hospitals starting back in 2022. That's that chart in the center. And what we've seen for nursing, respiratory, laboratory, imaging, we have vacancy rates of anywhere from 10 to 15% annually. Now, just to give you a snapshot, on nursing, the national average for the vacancy rate for nurses for the most recent data is 10%. West Virginia, it's 15%. And I use this as an example to show you that as we're producing more nurses, we're trying to produce more doctors, we're trying to produce more healthcare professionals, the challenge we have is how do we keep them in West Virginia because they can go anywhere in the country. Now, one of the biggest challenges that we do have is when you start to look at salaries. Now, there's a lot of great opportunities of why people move to West Virginia. I'm one of them. I moved to West Virginia 4 years ago, and it's a great place to be. But one of the challenges that we have is when you're making an offer to a doctor, a nurse, a respiratory therapist, what's the first thing somebody looks at? How much are you going to pay me? And unfortunately, when you look at the data from the Bureau of Labor Statistics, in those major job categories, West Virginia's average salaries compared to the surrounding states and the national average is anywhere from 5 to 20% below. This is a major challenge of how do we keep those young healthcare professionals in the state of West Virginia. Now, what does this mean for patient care? One of the things that I hear over and over and over again is, well, there's an empty bed. Why don't we have a patient in that bed? We don't have a bed problem. We have a staffing problem. This graph shows that the acute care hospitals in West Virginia were licensed for 6,300 beds. Right now, today, we're only able to staff about 2/3 of them. It's not because we don't have the bed. It's not because we don't have the room. We don't have the staff. This is a major challenge of how do we continue to ensure access to care? How do we continue to look at those opportunities in changing the models of care for the future? Now, if you don't remember anything that I talk about today, please remember this graph. This is probably the most important thing and the biggest challenge healthcare in West Virginia is facing. As I mentioned earlier, Medicare, Medicaid, PEIA, all 3 of those insurance programs pay providers less than the cost of care. Now, when you look at the national average, the average U.S. hospital, their governmental payer mix is about 40%. In West Virginia, the average hospital is 75% governmental payer. Since all three of those programs pay providers less than the cost of care, that means you have less resources for facilities updates, less money to invest in new technology, less money to offer competitive salaries and benefits to those young health professionals. This is our biggest challenge, and that's why I appreciate every time the governor, the legislature talks about a new business coming to the state, I applaud, because it helps change the payer mix and create greater opportunities in the state. Now, I want to talk a little bit about specifically the Medicaid program. Medicaid covers roughly 1/3 of West Virginians. Now, this is important because when you really dive into some of the specific services, Medicaid accounts for a much larger payment of the certain services. For example, almost 55% of mental health services are paid for by Medicaid. More than half, 1 in 2 births are paid for by Medicaid. And the reason I wanted to dive a little bit more deeper into the Medicaid program, because if you remember earlier this year, Medicaid was getting a lot of attention as part of the discussion of the Big Beautiful Bill. That was the bill that was a tax bill that had major provisions for health care included that was signed by President Trump on July 4th. Now, when you start to dive into this 2,000-page bill, there was numerous health care provisions included in the bill. To give you an idea, a lot of the changes that we're talking about are going to directly impact the Medicaid program. According to the Nonpartisan Congressional Budget Office, the 10-year costs of these provisions are going to work out to more than $800 billion reductions for the Medicaid program. This has a huge impact on the healthcare delivery system in West Virginia. Now, I will say somebody made a comment to me, they're like, well, I'm not on Medicaid, why do I care? Understand, when a hospital is recruiting a physician, hiring a nurse, opening a program, they don't do it only for the Medicaid population. They're doing it to serve their community. But when you take resources out from the Medicaid program, it will have an impact on the delivery system. Now, diving a little deeper into some of the specific provisions included in the bill. Now, first, we're going to look at Medicaid enrollment. One of the big discussions was the quote-unquote work requirement. So included in the bill is now an 80-hour requirement that Medicaid beneficiaries that are part of the expansion population, so this is the population that are on Medicaid between the ages of 18 to 65, they now have an 80-hour requirement to work monthly. Well, in West Virginia, already 65% of that population is working. Now, what we need to do is work with the Bureau of Medicaid Services to make sure the implementation of this provision, we get those individuals enrolled in the program, doing the accountability of their work requirement, so they do not lose their coverage. That'll be an important opportunity to ensure we don't see an increase in uncompensated care, that we make sure those individuals stayed enrolled. Other provisions in the bill, I'm going to specifically point out a positive. In the bill is a one-time payment adjustment for physicians of 2.5% under Medicare. That's good news because there was going to be a cut for physician payments included in the Medicare program until this bill was enacted. Now, there is also another provision of this bill that's going to have a direct impact on workforce. In the bill, they did cap student loans at $200,000 for healthcare professionals. Now, I point this out because right now the average student loan for a medical school graduate is $250,000. So the question is, how will that provision impact workforce in the future as the loan availability is decreased? So that is a provision we need to pay attention to and how it will impact the workforce. Now, the biggest provision for the hospitals in the Big Beautiful Bill was related to provider taxes and state-directed payments. Now, originally 2 years ago, the state legislature passed its provider tax on all hospitals going up to, at the time, the federal maximum of 6%. So the state is using that 6% tax on hospitals to create their matching funds to draw down those federal dollars. Now, West Virginia is fortunate on this side because our Medicaid mix, our matching rate is so high. For every $1 we put into the Medicaid program, we're drawing down $3 from the federal government. Now, the provider tax provision in the big beautiful bill will reduce the current federal max of 6% down to 3.5%. So this will have a huge impact on the resources that West Virginia can put into the Medicaid program. Now, what that means for the direct-to-payment program is we're also going to lose those dollars in support of our direct-to-payment program. Cutting to the bottom line, what that means for West Virginia hospitals, when these provisions are fully implemented, we will see more than a $1 billion reduction annually in resources in Medicaid. This will have a huge impact if fully implemented starting in 2028. So this will be taking resources out of the Medicaid program and the hospitals in West Virginia. Now, one of the positives in the bill is in the provisions is the Rural Health Transformation Fund. This is a new provision that Congress added in there to try to mitigate the cuts on Medicaid. This is a $50 billion fund that will be funded from 2026 to 2031. Now, one thing's to note, half the dollars are to be allocated equally among the states, and then the other half will be allocated through a formula to be released by the Centers for Medicaid and Medicare Services later this year. Now, we don't know exactly how much money West Virginia is getting, but we'll know we'll be getting at least $100 million a year for 5 years. Now, I was not a math major in college, but $100 million a year versus a loss of $1 billion a year. There's a big difference. Now, there is a great opportunities with these dollars because it does allow for a transformation in looking at new opportunities. Now, the governor did announce he's going to be creating an internal task force looking at how to allocate these dollars. And this is when we look forward to working with the governor and the legislature in how to invest these dollars wisely. The Hospital Associations Board, we're already putting together some proposals to look at, and we think two big buckets of great opportunity is public health. How do we make people in West Virginia healthier? How do we invest in wellness programs? That's a great opportunity. Also, how do we invest in new models of care? For example, how do we better leverage telemedicine? How do we make sure we're utilizing those resources better so those limited number of healthcare providers that we have, we make better use of them? Now, kind of shifting gears a little bit, we know the state legislature is going to be, the 2026 session is not that far away. We know the interim meetings are going to be coming up. In fact, in early September is an interim meeting where they're going to be looking at provider enrollment. And this is when we look forward to working with the legislature and how do we make access to care better across the state and reduce administrative burdens. Now, for the Hospital Association, we're really looking at our legislative agenda and looking at multiple things. One, ensuring we expand access to quality, affordable care. Also, we maintain the financial viability of the hospitals. We also look at how do we reduce some of the administrative burdens, such as provider enrollment with the insurance companies. How do we make it easier to get that provider licensed in the state and providing care faster? Also, how do we strengthen our public health delivery system and our workforce? Now, one of the things I'm often asked is, how do West Virginia stack up compared to other parts of the country? And I'll be the first to say, we do have our challenges. When you look at it, the nation, right now in West Virginia, we have the nation's shortest life expectancy. And this is directly attributable to we lead the nation in tobacco use, we lead the nation in obesity, we lead the nation in diabetes. We do have our challenges. At the same time, there is opportunities to show you certain things that West Virginia is doing, we're doing very, very well, specifically the cost of care. According to national data, we have the 13th lowest private insurance spend per enrollee. We are the 6th lowest in the nation for inpatient cost of care per day. So we're actually doing quite well on the cost of care. We do have our challenges with public health and population health, and that's why we look forward to working with the governor and the legislature. How do you address those issues to make West Virginians healthier? I just want to say thank you for the opportunity again, Dr. Nimitz. Thank you for organizing this great event, and thank you for the opportunity to present today.